the other thing that we should probably discuss a little bit too is if you have a missing tooth that you can't find, you should be taking a radiograph of that horse because you can have impacted teeth, which are teeth that are hitting another tooth or some structure that are not allowing them to erupt in their normal pathway. And we can often see those in the mandibles, where a premolar will be laying in a angled position in a rostrocaudal direction, say an O8 hitting the O7. So you go into the mouth and he's a 5-year-old horse and he still has a deciduous O8 tooth, and you think, why is this still here when the rest of the O8 caps are missing? It's time to take a radiograph of that mandible to identify where did that tooth go. Certain species lack some of their dentition, or certain breeds, sorry, not species, but certain breeds lack some of their dentition. So if we're talking about a miniature horse with a retained or a persistent deciduous tooth, I want to take a radiograph of those patients because sometimes they just don't get a full permanent dentition as well.
Of course, yeah. I notice also, or have observed that when I'm teaching veterinarians dentistry, most people tend to be really concerned about the floating. They want to get really good at the floating. And floating is, in my mind, a really important part of treating a horse. But I think the oral exam is way more important because, as I said before, what can't be seen can't be diagnosed, and what can't be diagnosed can't be treated. So I guess in my hands, the oral examination, so the external head exam, the oral examination takes far longer than the actual floating act itself. So, Dr. Henry, what role do you find that oroscopes are having in our oral examination protocols? Oroscopes are becoming a lot more prevalent and a lot more widespread over the last couple of years for looking in these mouths.
Well, I have 2 points just before I dive into that too, is that I think one of the things that we get hung up on is that the client is paying us for the floating. That's what their intent is, having you out to the farm to do, is they want to see you sweat. Okay, they want to see you work. And so they're often have to be sold on this oral exam too, that you're going to take some time, because I've had clients actually say, why are you messing around looking in there so much? The last guy just jumped right in there and floated his teeth and got out. So we have to explain to them the importance of this as well. And it can be a good marketing tool for you as well. But so, I'm in total agreement that this is the most important thing. I tell clients actually that I don't care their horses get sharp points. It's like mowing your grass. It's going to come back. If a horse is masticating and has a normal pattern of eruption, they're probably going to develop some sharp points depending on what they're eating for a diet. And when you tell a client that, you really open their eyes, because you then segue into how important this oral exam is. Because horses that have endodontic disease and periodontal disease, that's what we really have to identify early. Remember, periodontal disease is a progressive condition in these patients. If we leave it alone, it's going to get worse. And endodontic disease is fatal death of that tooth. We can't bring them back to life. So they need either a root canal or an extraction. That treatment plan only has 2 branches. So that's the important part of that situation. But oral endoscopy is extremely important, I think, and it's becoming more and more prevalent out there as a lot of technologies come avail in the last few years. And where I find it very important is in documenting cases, is the major thing for us.